DW.
Palestinian families and friends in Bethlehem come to Afteem's for what many consider to be the best falafel sandwich in town. There they can relax on a Friday afternoon as foreign tourists crowd outside in Manger Square to visit the Church of the Nativity. Just a few blocks away, you'll find the offices of Suna Al-Amal, a Palestinian organization dedicated to training up more badly needed psychotherapists, as founder Fadwa Abad explains.
Suna Al-Amal means hope makers in English. يعني لاحظنا إن هناك يعني two gaps.
We created the master's degree program in psychotherapy because we're trying to close the gap for psychological services that are needed but don't exist adequately here. For more than 65 years, Palestinians have been living under occupation. They are experiencing depression, trauma, and fear. Some children have seen their homes destroyed or have witnessed violence and are bedwetting and refuse to go to school. Unemployment for adults of different ages has created depression and despair.
Clinical psychologist Yud Ganadri supervises the master's program students. She says it's significant that this is the first time a high-level degree in psychotherapy is being offered in the Palestinian territories.
In Palestine, we have all the spectrum of psychological disturbances as any other country in the world, but the percentage is on a higher level. Year by year, the general support systems that were very much valid in the past are now losing strength. That's why we need to bring additional support systems, not instead of the old ones, but beside the old ones, so that our people will be helped as they deserve. We are around 5 million people, and we need psychotherapists graduated from our universities speaking our own language. We are preparing them, taking into consideration our Eastern culture, our local situation, and we don't rely only upon Western theories and practice.
Hamza Meshal is one of the students participating in the Suna Al-Amal program, and he works at the Hal Khul Community Center for Mental Health near Hebron. He and his patient say they have seen remarkable progress so far.
I'm proud of her because of her improvement and for her motivational power. Even with her hard situation, the therapy helped her and her children to be better.
They referred me here for my son's speech therapy. They told me it's a psychological and mental center. I hesitate because, the stigma in the society. It's not an easy thing, But then I got the courage and I want the best for my son. They have this strategy that they also support the mother. Mr. Hamza met me, and I discovered that I have a lot of issues that I need to work on. For example, abuse. People don't recognize abuse as physical abuse is recognizable, but verbal and mental abuse is also, yes, it's abuse. We start our meeting, and I have been progressing. I'm being a better mom. My son can attest. I have 3 kids with different disabilities. I have much progress. I'm trying as much as I can to help others because not everyone have the courage to come here.
The poorest area in psychological services in Palestine is Hebron, especially the specialized one. We are the only specialized center in the Hebron. But we only have 3 psychologists, 1 nurse, 1 speech therapist, and 1 psychiatrist for about 700,000 people. So I think that you can imagine how many patients are in the waiting list.
Al-Quds University in Abu Dis is partnering with Suna Al-Amal to provide training and the certified degree in psychotherapy. I've come to the university to speak to the professors and students on the program. Although Ashwaq Abdullah studied counseling and psychology in the U.S., she says the master's program has helped her to deal with patients' issues, like schizophrenia, which before she was unable to handle. But there are other more daunting challenges she faces as a psychosocial counselor for high-risk Palestinian communities.
Some people had their homes demolished 3 times in 2 months.
That's continuous trauma. It's so hard to work with people who, okay, I can try to pull you out of the trauma. I try to listen. I try protection issues. But really, after I work with a family and then I hear that their house got re-demolished, they go back to square one. I try to work on resiliency. Like, this happened, your house was demolished, but what are the positives? You're all still together. You have a support network around you where people are willing to take you in until you get your house fixed. It's horrible, and there's not really, in situations like this, sometimes I feel helpless.
Najah Mahmoud Al-Khatib teaches Ashwaq and others participating in the psychotherapy master's degree as part of the university's community mental health program. The first psychiatric nurse in Palestine, she now also supervises their clinical work.
It's a big challenge for them. It's not easy. They need a lot of support. They need supervision on a weekly basis. They work with mentally ill patients, social cases like abuse and underprivileged families, divorce, widows who cannot overcome the death of their husbands, families of martyrs, families who have been exposed to political harassment from the Israelis. Some of them, they didn't have any clinical experience in the beginning. And now with us, they are working in a group and a family. I see some improvement, yes. These people, when they graduate, they will provide better services. And this is why we are very keen to invest in mental health, including this program, the psychotherapy, because we want to help our community.
Dale Gaflak, DW, Bethlehem.
This report was brought to you by DW.